Hello, Gold participants from around the world. I'm Fleur Bickford, Program Director and MC for Gold Learning. I'm chatting today with Dr. Anjana Srinivasan about her upcoming presentation titled Tongue Ties Demystified. So, Dr. Anjana, thank you so much for being with us today.
Thank you.
So, very excited to have you as part of the symposium. So we're going to get started with just a few questions here. And to start with, perhaps you can just tell our delegates a little bit about yourself and your professional journey and how you came to become involved with tongue ties.
Sure, thank you. So first of all, I'd like to thank Gold Symposium for inviting me to speak on this very interesting and exciting topic. A bit about myself. I'm a mother of two kids who both breastfed. I actually started in the field of lactation before I had any kids, when I was doing my family medicine residency at the Jewish General Hospital. There was a breastfeeding clinic there that opened up around the same time that I was doing my residency. So as a resident, we all had to be placed. We all did observation periods and stages in the clinic, and so my interest grew from there. I had a couple mentors who were really amazing in the beginning, Carol Dobrich and Dr. Pearl Feldman, who really got me very interested in the field. I finally decided to become a lactation consultant, so I wrote my exam in 2005. And I've been working in the breastfeeding clinic at the Jewish General Hospital in Montreal, Quebec since 2003 actually, since I finished my residency in family medicine. So since then, my interest has really been growing. We're a hospital-based breastfeeding clinic, so we see referrals of complex breastfeeding cases from all over Montreal and nearby as well. So we end up seeing a lot of tongue ties, and we perform frenotomies, and we've had a very good success rate and really have seen a difference with the frenotomy procedure in our patients. So I'm excited to talk about that today.
Okay, wonderful. Thanks. We're very excited to hear more. And I love that your interest actually started before you had kids.
Yeah.
Typically the story that we hear is that, people had their kids and then the interest grew from there. So it's wonderful to hear that, the residents were required to do a rotation in the clinic and that was how your interest started.
Yeah.
So I love that.
Yeah.
Um, so next question is, I know one of the things that you're going to be talking about in your presentation is assessing for tongue tie. And I know that that's something that a lot of our delegates struggle with a little bit and don't feel particularly comfortable. I'm wondering, what are your thoughts on the best way to become more comfortable with assessment for oral restrictions?
I think the best way to become more comfortable is to do a lot of oral assessments. So when I do teaching for residents and students and learners at the breastfeeding clinic, I always encourage them to examine all babies who are having difficulties with breastfeeding, babies who are not having difficulties with breastfeeding. It's important to do a full oral exam, check the suction, check under the tongue, and really examine the tongue movement so you can feel comfortable with a normal tongue movement and a not so optimal tongue movement. So the best way to become more comfortable is really to do a lot of assessments, I think, and also to attend conferences, listen to people, do stages, talk to people about how they do their assessments and their evaluations of tongues and tongue ties. And oral restriction. So I think we learn a lot from listening and attending conferences of other people, which I try to do as much as possible because I think the learning never ends. So, yeah.
Yeah, absolutely. Very good point that learning never ends. And, I love your point about, just doing oral exams on every baby. And that's, I know I certainly found for myself as I was learning, that was a big thing for me was just, I remember in the very beginning, I really felt like I didn't know what I was doing, but I would, put my finger in the baby's mouth anyway. And gradually, with more and more exams, you start to really
Exactly.
learn.
It's really practice that makes you better at what you do, and also the open-mindedness and the flexibility of being able to change and learn from other people. Even if you've done 100 exams or however many exams and you think you're an expert, you're never really an expert. Things keep on changing. You can keep on learning. So I think it's important to keep an open mind.
Very true. And that actually
And
leads
to
us,
learn from your patients. I think we learn a lot from the mothers and the babies that we see. So
oh, that is such a
I
good
learn a
point.
lot from them as well. Yeah.
Yeah. So that comment about, keeping an open mind kind of leads into my next question. You know, tongue tie it's always been a bit of a controversial topic, but it seems like maybe the controversy is growing a little bit right now. A lot of people questioning, you know, why are we suddenly seeing all these tongue ties? Are we doing the right thing by releasing them? All of that. So, curious what your thoughts are about why tongue tie has become such a controversial topic.
So that's a really good question. Um, I'll give you my take on it. I think we're perhaps seeing more tongue ties and performing more frenotomies because perhaps people are breastfeeding more. So when people don't breastfeed as much, then we don't see these problems because, of course, when you suck on the bottle, or you don't necessarily need the tongue to be moving as much as when you're sucking on the breast. So definitely there's that. In terms of why it's become controversial, I think it's because I feel it's very important to have a proper assessment and identification of the tongue tie and to do the frenotomy for the right reasons. So I think what ends up happening is sometimes frenotomies are done when perhaps there were other issues that needed to be managed as well or with the frenotomy, and so people feel like maybe the frenotomy didn't help and oh, we're doing too many frenotomies and this kind of thing. I think it's very important to have um, an approach where you try to deal with all the issues, including perhaps doing the frenotomies, but also to manage all the breastfeeding issues. The other thing is that I feel it's important when you assess the tongue tie to not just look at the anatomy, but also look at the function, the movement of the tongue, and how the baby breastfeeds. I think without a complete breastfeeding assessment, it's really hard to tell whether this tongue tie is problematic or not. We often have cases in the breastfeeding clinic where a baby with tongue tie will come and present, and the parents will ask if a frenotomy is needed. And if breastfeeding is going really well after an evaluation, we might tell them to come back for another evaluation a week or two later. But if things are really going well, we don't perform a frenotomy. So we're really careful about the population that we choose. And we feel like we try to only do frenotomies if we feel like we've tried all the other things and there remains persistent breastfeeding problems, despite management of other issues. Um, yeah.
Okay, so
I don't know if that
interesting.
answered
And
most of the question.
no,
There's a lot to be said on this topic. I think the other reason why it's controversial is because there's no unifying kind of guidelines or recommendations or even a unifying way of, how people diagnose tongue ties. People diagnose tongue ties and use different criteria and screening tools around the world. So
mhm.
it's not like some other medical or, lactation diagnoses, which are a bit more simpler, like people tend to diagnose in the same way. This is something very controversial and very varied in terms of how people identify and assess tongue ties. So until we have more studies on the topic and better screening tools that more people use, it's going to remain controversial because people assess tongue ties in different ways. What I say is a tongue tie may not be a tongue tie for someone else, or maybe a severe or less severe. We all have a different way of looking at things. So that
Yeah,
also plays into it.
absolutely. And I think, one thing that I've noticed is, for one thing, it's a growing area of study. Um, but one thing that's been really interesting for me is when you look at, like some of the professional forums and stuff, it's the number of different types of professionals. And that's
Yes.
always fascinated me is that we're not just talking about, lactation consultants, people that are becoming interested in this and providing input and perspective are coming from so many different areas. We've got the lactation consultants, breastfeeding medicine doctors, sleep medicine, ENTs, all of these different professionals that have a different perspective. And I love that because it's so fascinating to see how, the tongue, just that one part of the body is, causing enough impact that we've got all these other professions coming in and are interested in realizing, hey, yeah, this actually, wow, this has an impact on this and this and this.
Right, right.
And it's really quite fascinating. So I think it'll be very interesting to see, as the field grows and as we get more research and information and, like you say, the screening tools and all that sort of stuff. So lots and lots to
Right.
talk about there for sure. So looking forward to hearing more from you. So as we
Great.
finish up here, maybe you can just very quickly tell us what you hope the delegates will be able to take away from your presentation to take back to their own practices.
So I hope they can take back just some of the assessment tools that I'll be talking about, the way we evaluate tongue ties at the breastfeeding clinic where I work. Also, just some of the symptoms and signs that we see in the mother and the baby when they have tongue ties. A little bit about the frenotomy procedure and a little bit about the current research and ideas for the future in terms of research, development of screening tools, assessment, educating other professionals. I think those would
Wonderful.
be the main take-home points, hopefully.
Oh, wonderful. Well, I am very excited to hear more from you. So thank you so much
Thank you.
for chatting with us today. And for our delegates who are listening, you will be able to hear more from Dr. Anjana during our Tongue Tie Symposium happening live on September 17th. So we look forward to seeing you then. Bye for now, everyone.
Thank you very much.